once again welcome back to Epi Doc videos. And guys, आज का टॉपिक है जॉन्डिस। एंड मेरे बहुत से फ्रेंड्स हैं जो साउथ से हैं। उनकी डिमांड थी कि इंग्लिश में वीडियो बनाया जाए और हिंदी कुछ कम समझते हैं, तो आज का वीडियो इंग्लिश में कंटिन्यू करेंगे। सो लेट्स स्टार्ट with today's topic, jaundice. And means what is jaundice? So if we talk about the perfect definition, then jaundice is a yellowish discoloration of sclera, mucous membrane, and skin. So we all knows when the bilirubin level is high in blood, then it will cause jaundice. So exactly means little bit amount of bilirubin is high, it's considered, but near about 2.5 2.5, this is the threshold. And if bilirubin level is high more than 2.5, then we consider as jaundice. So firstly we have to do some test of this patient, like three tests is mandatory here, like a liver function test, LFT, and liver ultrasound we will do, and we do urine test for check bilirubin in urine. According to this we will find the what is the cause behind this jaundice. So there is so many causes, and that we divide into prehepatic jaundice, hepatocellular jaundice, and obstructive jaundice, or that means after the liver, like biliary system is obstructed here, that we consider as obstructive jaundice. So by this three tests we can do investigation of this patient. And if the LFT is normal and ultrasound also normal, and urine is negative for bilirubin, then we consider this is the prehepatic cause, because all three tests are here negative and normal. So for prehepatic jaundice we again do another test that we called blood smear, or the we also check the reticulocyte counts. And by this method we can means find out the what is the cause behind the jaundice, because when the RBCs are breakdown, that one of the cause of high bilirubin level in blood. So by this blood smear and reticulocyte count, we find out the any hemolysis is there or not, and according to that we treat this patient. So if there is no evidence of hemolysis, then we consider the Gilbert syndrome. So in Gilbert syndrome, there is a decreased activity of UDP glucuronyl transferase. That's why the here is the isolated elevation of the unconjugated bilirubin is present here. So there is so many causes, and like anybody is fasting, or alcoholic patient, and any infection, and in some cases in fever also cause that condition. And if we talk about treatment, so usually no need of treatment is here. If guys elevated conjugated bilirubin is present in the test, then we consider the Dubin Johnson syndrome and Rotor syndrome. In this both condition, the conjugated bilirubin level is high. So it is one of the type of autosomal recessive condition, and benign condition is this is. And in this elevation of conjugated bilirubin is present. And it's if we talk about the defect, that defect in bile transport, like one of the protein is there, bile transport canalicular protein. In this defect, because of this defect, it will cause, and in which the liver grossly black in Dubin Johnson syndrome. Means so if epinephrine metabolism not going well, and that epinephrine is accumulated in liver, that's why the liver get blackish coloration, so blackish pigmentation is occur here, and it cause jaundice. And here also means treatment is not usually recommended and not necessary. And one another condition is rotor syndrome. It's also similar to the Dubin Johnson syndrome, only one difference is there, that liver no changes in liver color, the means no discoloration is present in liver. So these are two syndrome associated with that. And next we see hepatocellular jaundice. So now we will talk about the hepatocellular jaundice, and here we consider if the LFT is abnormal, then in hepatocellular jaundice we look for the ALT and AST elevation here. Means ALT and AST is very high in proportion to ALP in hepatocellular jaundice, and raised conjugated bilirubin is present here, and in which ultrasound is normal, and urine also positive for bilirubin. So we do another some test here, like we check for clotting profile, and we check for hepatitis serology, and any type of autoimmune hepatitis here. And like for this we check AMA, ANA, and AMA is anti-mitochondrial antibody, ANA is anti-nuclear antibody, and SMA is the smooth muscle antibody. We do this, and if the age of this patient is below 40, we do iron study, means any iron deficiency or another causes, and we check the alpha 1 antitrypsin deficiency. We do toxicology screening, like any example we consider the acetaminophen poisoning, like this. In a hepatocellular jaundice we go for that. And then we talk about the obstructive jaundice. So in obstructive jaundice, LFT is abnormal, but here is the ALP is rise out very high in proportion to AST and ALT. So raised conjugated bilirubin is, and we can see here abnormal ultrasound is present, because any obstruction in biliary tract, any means any stone is there, or any tumor is obstructed that area, we can see is the abnormal ultrasound, and the evidence of biliary disease is present here, and urine is positive for the bilirubin. So in obstructive jaundice we have to do cholangiography, and we also do the ERCP and MRCP. And if these all labs are normal, and ultrasound is normal, and all tests we are doing that all are normal, then we consider the pseudo jaundice. So there are some causes of the pseudo jaundice, like the hypercarotenemia due to the high vegetable diet, like some patients are eating too much carrots. Uh, in that situation, we can find this type of pseudo jaundice. And in Addison disease, some patients suffering from Addison disease, they will also one of the example, and that cause anorexia nervosa in Addison disease. These are some causes of pseudo jaundice, and by this method, we can find out the jaundice, and we can do management according to that. So, guys, thank you for watching this video. I hope you liked this video. And please subscribe, share, and if you have any queries, please comment on this video. I will definitely make reply to these queries. Thank you guys. Good night.